All right, so my name is Grace. I use she, her pronouns. I am with Personal Pack, and I'm also part of Jane's Army. And I'm really glad that you are all here tonight. A couple of housekeeping items. As you can see, the event is being recorded just for our records and to be able to share with others. So if anyone is not comfortable with that, go ahead and turn your video off, or you can change your name so that it's not listed. But we would also love to see your faces if you are comfortable with that. And the other item is that we will be having a Q&A session in a little bit here. So if you have any questions that come up this evening, feel free to direct them in the chat to me. You can just send it to me, Grace, Personal Pack, or you can put it in the general chat and we will hopefully get to it. So with that, I will give you a quick update of where we're at. And again, if you could please make sure you're on mute, that would be great. So if you attended, okay, if you attended a previous Jane's Army event, then you might be a little familiar with some of this. But the stakes are so critical that it's worth repeating. So over the past 40 years, the radical anti-choice movement has been pursuing a single goal, which is to overturn Roe v. Wade and make abortion illegal and banned in every state, including Illinois. And now we finally have the Supreme Court to make this happen. And as you can tell from just being awake and maybe reading the news, people are making no wasted time here. There's been attack after attack. And sadly, this is going to continue happening until basically abortion is unavailable, which many people are already living with. And now as we turn to Illinois, we have some critical races coming up this June and November. The Illinois Supreme Court is only a single seat away from controlling the 7-member court in the same way that they now control the US Supreme Court. So the stakes are incredibly high, and we are not exaggerating when we say the future of Texas could be the future of Illinois here. So if we allow the anti-choice extremist movement here in Illinois to gain any seats in the General Assembly or the Supreme Court races, things will look radically different than they do now. And we will also be considering without Roe. So that's where we are here tonight, to try to do something about that and to fight back. So thankfully, we have a current governor who is one of the most pro-choice leaders in the country. We have a slim but still majority of pro-choice elected officials in the General Assembly, and we intend to keep it that way come this November. So tonight you'll hear from some of our guest speakers about where we're at in terms of abortion access and reproductive rights, and what you can do about it to fight back against these restrictions here in our state, which also benefits people from other states.
I'm listening to through my choice.
So with that, I will pass it over to Hannah to introduce our speakers and get into the meat of this conversation. Thanks, Hannah.
Thank you, Grace. Hi, everyone. My name is Hannah Fearley. I use she, her pronouns. I'm a board member with Personal Pack, and I'm also a co-chair of the Future Voices Council and a member of Jane's Army. So we're often asked about the differences between Plan B or emergency contraception, medication abortion, or more commonly something we hear as the abortion pill, and surgical abortion. So I'm really glad to be able to welcome our guest speakers in just a minute to help us understand the differences and why it's intentionally confusing. Before I do, I want to point out that while the details are different, the anti-choice extremist movement is coming for abortion care, birth control, and so much more, regardless of how the care is administered. Also important to note is not a single anti-legal abortion organization supports access to birth control, contraception, and nearly all of them actively oppose it. This is why it's so critical to remind everyone, that we can't let our guard down or put too much hope into one solution, because the other side won't stop after one success, which is why it's so critical that we get educated, get engaged, and fight back at the ballot box this year. With that, I'll introduce our amazing speakers. Dr. Sobia Ansari is an emergency physician and associate professor in the Department of Emergency Medicine at Rush University Medical Center. She graduated from SUNY Downstate Medical and Medical School in Brooklyn, New York, and completed her residency training at Drexel University in Philadelphia. She moved to Chicago to pursue training in global medicine and to obtain a master's in public health at UIC. Dr. Ansari is also a Personal PAC board member where she advocates for reproductive rights at the state and local level. Her other passions include advocating for health equity and single-payer universal health care. Our second speaker, Kadeen Bennett, is the Director of Advocacy and Intergovernmental Affairs with the ACLU of Illinois, where she leads initiatives on a wide range of issues from privacy and technology to criminal justice, LGBTQ, and reproductive justice. As part of her work, Kadeen has drafted a number of pieces of legislation that have been successfully moved to the governor and signed into law. Kadeen was a critical player behind the recent repeal on PNA through the passage of the Youth Health and Safety Act last year. We're proud to work alongside her on such important matters. And Dr. Allison Cowett is the Medical Director of Family Planning Associates Medical Group, a Chicago family planning clinic and one of the largest independent abortion care facilities in the country. Dr. Cowett is a faculty member in the Department of Gynecology at the Northwestern University Feinberg School of Medicine. She's also active in community-wide efforts to enhance access to family planning services for women in marginalized populations and to forward a legislative agenda that champions women's reproductive freedom. So thank you all for being here tonight, and we look forward to the conversation ahead.
So I think we can kick off our
go ahead.
Hannah, you can start us off with our questions.
Oh, okay. Yeah. So the first question is for Allison. Can you explain the actual differences between Plan B or emergency contraception, medication abortion or the abortion pill, and surgical abortion?
Absolutely. Thanks so much for having me, and thanks everyone for being here. These are such important questions in difficult times, and any time that people can take out of their busy lives to be more educated and understand a little bit more of what we're dealing with is really appreciated. And Personal PAC is my absolute favorite reproductive rights advocacy organization. So I am always happy to be in connection and in advocacy spaces with you all. So I think this is a very important question, mostly because, as we'll talk about, Hannah talked about already, and we'll talk about some more later, the fact that the anti-abortion folks would like to not only outlaw abortion, but also would to get rid of all of women's access to reproductive healthcare in general, including contraception. This is really evident at times when we interact with the anti-abortion folks. So let's just talk, I'll talk for just a second about sort of the very simple differences between emergency contraception and medication abortion. So emergency contraception, what is commonly known as, or the most commonly known medication is Plan B. Plan B is available over the counter, and it's a progesterone medicine, a female hormone medication, which provides for an opportunity to be taken after an act of unprotected sex and will significantly decrease the chance that a person will become pregnant after this having sex that was protected with either another form of birth control or condoms. And actually Plan B being available over the counter is actually one of several different types of emergency contraception, most of which can be used up to 5 days after the unprotected. So people have known emergency contraception for a long time as the morning after pill, but we sort of stopped using that terminology in gynecology and in medical circles because it's not just the morning after unprotected sex, but actually up to 5 days that the chance of getting pregnant can be reduced significantly. Using an IUD, actually placing an IUD can also be used for emergency contraception. So that is in contrast to, and I should say these emergency contraceptive medications do not interrupt a pregnancy that has already been conceived and is growing inside the uterus. So that's really the most important point to be made. Emergency contraception is for even if taken when a person is already pregnant, will not interrupt that pregnancy. And we know that to be true from a lot of scientific evidence. Medical abortion, in contrast, is to be used when a person is already pregnant. It can be used from the very early times, weeks in pregnancy up until 11 weeks or 77 days after the last menstrual period. So very different from emergency contraception. It is used to end a pregnancy medically when a person is already pregnant. It's a series of 2 motions that are taken and essentially induce a miscarriage that a person can have in the privacy of their own home. And this medication abortion is in contrast to surgical abortion, which refers to a procedural abortion or abortion that's done in an office or a operating room setting that is a procedure performed by a healthcare provider that will then end a pregnancy surgically and does not require medication. So hopefully that answers the question.
Yes, thank you for that explainer. That was helpful just to establish some of the terms we'll be using. So for the next question, Sylvia, could you briefly discuss why you think there is confusion around these terms and why the blurring of the lines done by the anti-choice movement is intentional and dangerous?
Oh, yeah. Thanks, Hannah, for that question. And thank you so much for having me. Being a board member of Personal PAC is one of my most favorite things that I do outside of work. So it's a real privilege to be here. So, I think that we can all acknowledge that we are living at a time when misinformation is being used as a tool to rally and ignite people, to get people to get organized to restrict the freedoms of certain Americans. And in this case, it's the freedoms of American women. And misinformation is being used as a tool by people who are in positions of power, right? Last year, we saw Congresswoman Marjorie Taylor Greene publicly said that emergency contraception would induce an abortion. She said this publicly. This is factually wrong. And so this is unfortunately the environment that we are living in, that we're working with. And so it's really important that we are kind of informed about the tactics that are being used by the anti-choice movement so that we can respond in kind. And, we see misinformation happening, with something as recent as the COVID pandemic, with things like mask mandates and vaccines. So why is this happening and why is this dangerous? Well, we see that the anti-choice movement has made strides, unfortunately, in restricting abortion clinics and abortion healthcare providers in providing surgical abortions. And so the next step is to restrict the ability to get access to the abortion pill. And then eventually just to restrict all control women might have on their reproductive choices, and that includes contraception. The FDA at the end of last year made it so that it would be easy for a woman to get the medication abortion bill at home, so that in the privacy and the safety of her home, she can exercise her reproductive choices. And this must be infuriating to the anti-choice movement. When the Affordable Care Act was passed, they made it so that the Affordable Care Act made it so that health insurance policies that were part of the marketplace were mandated to be able to cover contraception. As we have been working to make progress in making these choices easier for women, the anti-choice movement has responded with misinformation because that's really the only tactic that they have, right? Because we have science on our side, we have biology, we're right. And so misinformation is the only way that they can respond. I hope that answers the question.
Yeah, thank you. Thank you so much. So the next question is for Kadeen. Could you speak to some of the recent attacks on reproductive health care and abortion access we've seen in the past year? And that was kind of the first part of the question. And then how anti-choice extremists are working to specifically target abortion pills so that this option won't be safe if Roe falls.
Yeah, so thank you for having me. And again, Personal PAC is one of my favorite organizations to work with to protect women's access to reproductive health care and all folks who seek that care. So I appreciate being here and seeing all of the folks who are joining us tonight. So I'll start with facts because facts are good. We are the side who believes in facts and science. So I'll start there. So according to Guttmacher research, medication abortions accounted for 54% of all US abortions in 2020. And with the increase in use, it's become another major target of anti-abortion. And I like to, instead of anti-abortion, it feels like they're more like forced pregnancy advocates who are working really hard to restrict access. So between January 1st and April 14th of this year, there were 116 restrictions just on medication abortion introduced in 22 states, including 8 measures that would ban a medication abortion outright. 14 restrictions on medication abortion were enacted in 2 states, Kentucky and South Dakota, and you will hear South Dakota is just the worst of the worst. So we probably need a personal PAC there. So some of the examples of those restrictions, there were 8 states that introduced bills to ban the use of medication abortion. Thankfully, so far, none of those have been enacted. There were 9 states who introduced bills to prohibit mailing of abortion pills. It was enacted in 2 states, Kentucky and South Dakota. There were 10 states who introduced bills to restrict administration to just physicians, and they were enacted in Kentucky and South Dakota. And there were 3 states that introduced bills to limit provisions of Medicaid abortions at a specific gestational age. And it was enacted in 1 state, any guess? South Dakota. So if you're of reproductive age, probably not a great place to spend a lot of time in. And we're sure that some of those folks are going to be coming to Illinois. So last year, after Texas passed SB 8, their very strict abortion ban, surgical abortions in the state dropped by half. The week the law took effect, one service that delivers pills by mail reported that requests for medication abortions went up from 11 a day to 138 a day. However, the same day that SB 8 passed, anti-choice lawmakers passed SB 4, which made it a felony to provide abortion pills through the mail and required doctors to comply with new testing and reporting procedures to prescribe them. We already have 19 states that prohibit pills from being prescribed by telemedicine or delivered through mail. And we know that half the states that are out there are expected to outlaw abortion if the Supreme Court overturns or weakens Roe. And bans on abortion also apply to medication abortions, not just surgical abortions. So thinking about our surrounding states, Kentucky just passed an omnibus bill of restrictions that, among other things, specifically restricts access to medication abortion by banning telehealth for medication abortions and requiring the state Board of Pharmacy to certify providers who dispense abortion pills. Until abortion providers are certified, they're preventing from offering medication abortions, but there are no plans to set up a system to offer that kind of certification. I know that our national office is working with the ACLU of Kentucky to file a legal challenge to seek to block this law on behalf of a provider, but that law is currently still in effect. We have states like Missouri who are attempting to reach beyond their borders to stop their residents from going anywhere else to get an abortion, either by pill or surgery. And we see that there's a bill in Iowa that would ban the distribution of pills entirely with punishments of $10,000 and up to 10 years in prison. And just today, there was an article that talked about how within the past year, 8 states have proposed or enacted laws to limit abortion education and training in medical schools. So while I think one of the things that we know from these advocates of forced pregnancy is that when they're in power, or even if they're not in power, they are continually churning out these awful repressive laws. I wish the Democrats, when they're in power, pro-choice folks, that they would counter with the affirmative, but this is the lay of the land that we're experiencing right now.
Thank you. That really puts into perspective how lucky we are here in Illinois, but I know there's still work to do, and just puts into perspective what's happening even in our neighboring states. So thank you for that answer. For the next question, this is for Allison and Sobia. I'm wondering if you've experienced any ramifications of these restrictions with the patients that you see and support. And Kadeen, feel free to, if you'd like to weigh in here as well.
I can start if you prefer. As the medical director at Family Planning Associates, where we are providing both medical and surgical abortion 6 days a week, we certainly have seen over the last several years an increase in the number of patients who are coming from out of state to seek abortion care. And this has always been true, for several of our surrounding states who have always had more restrictive abortion laws than Illinois, or at least since Terry Cosgrove has been working at Personal PAC. However, over the last couple of years, these restrictions have certainly become more onerous. And starting on September 3rd, I started seeing patients traveling from Texas for care. So it happened immediately, after the September 1st, after SB 8 passed. And since that time, we've been seeing a significant number of people who are traveling. We certainly know that this travel is a huge burden for folks who are coming to Illinois. They're coming from long distances. They have to find money for travel and other resources, childcare. I've had, we can think about this in the big picture, but I always think it helps to stories about individual women. I've had women who come on their own in terms of not other adult supports, but do bring their children with them, having to pay either train or plane or bus tickets for their children to come with them, and then having little resources of what to do with them when they're here in Chicago for their procedure. So certainly there are many ones, both in Texas and throughout the country, that have been working, around the clock and tirelessly to help support women with different resources. But it's an endless job, and certainly these barriers disproportionately affect poor women and women of color who disproportionately seek abortion and are more likely to be financially burdened by additional by pregnancies that, as Kadeen says, which I really like, that forced pregnancy situations. So I'm the most worried about women with low resources, and these are the people that I feel, the people that actually get to Illinois and come to our clinic are the lucky ones who have been able to travel and come to see us. But we certainly know that there are many more that are not able to make those that don't have the resources for travel or to miss from work, or to bring children along with them.
From the emergency department perspective, I think our concern is that as women have to travel further and further to receive an abortion or any reproductive health care, they're gonna, if there's any follow-up care, they're going to go to the local ED, which is in the state that they live in. So those emergency physicians might start seeing women who are getting abortions elsewhere and then coming in for follow-up care, not necessarily due to complications, because abortions are so safe. And we've looked at the data and seen that follow-up care or any complications resulting from an abortion are so low, like way less than after you get a colonoscopy, or after you get your tonsils removed, or after you've had your wisdom teeth removed. I see more people after these things than definitely for sure after an abortion, but they may go in because they have a question, or maybe they remember something later on and they're like, oh my gosh, I forgot to ask my doctor so-and-so, or I have a pain, I don't know if this is normal. So I think some local EDs might start to see the ramifications of this. Plus, I am also concerned that women in Illinois may not know, the opportunities that they have or the freedoms that they have in our state. They might just assume this is happening everywhere. And the misinformation might also prevent them from seeking out access to contraception or emergency contraception or the abortion pill. So I think in Illinois, it's going to play out a little bit differently. And so, I think as healthcare providers, we're just need to inform our patients and just to have an open dialogue with them and make it as a comfortable and open an environment and safe environment environment for them to be able to talk about these issues.
I think one concern that I have is around minors who are trying to access care. We know in part of why we repealed the parental notice of abortion law is because it created these obstacles for young people who are seeking abortions. And just to imagine that I've represented minors who are in the suburbs, and trying to get them to come to Chicago was really different for both a court hearing and also for their follow-up procedures. So imagine if you're a young person coming from these surrounding states where you may or may not have support, you may not have the money it takes to get here. Once you're here, you're in a new state by yourself in a really difficult circumstance. And so I know that there are entities that exist to help support them, but we're not seeing a huge amount of young people from other states right now, but in part that could be because it's really difficult for them to be able to come here, as opposed to trying to figure out what you're gonna tell your parent for being absent for 2 hours. This could mean 2 days or 3 days. So that harm is real, and I think for a lot of young people it may mean that they're becoming parents when they're just not ready at all. And they're also in states where there is no sex ed, there's limited access to contraception and care and support. So again, going back to this idea of you're forcing young people to be pregnant when they actively don't want to.
Thank you all for that information you just shared. So the next question is for Kadeen again. Could you share a bit about the current Illinois political landscape and how the upcoming election might impact items like birth control, emergency contraception, and access to abortion care?
Yeah, I think Grace touched on how important it is for the Supreme Court races. And I think I saw Terry put something in the chat. He wouldn't be Terry if he didn't mention the Supreme Court and how close we are to having an anti-choice majority. And when people ask, well, what does that matter? We have the Reproductive Health and Access Act. We're good, right? Well, not really if it's an anti-choice majority court. If we were to go to litigate cases under the Reproductive Health and Access Act, an anti-majority court may lead to detrimental results. So all of the work that we put to have guardrails in place might not be as effective if the folks who are making the decisions aren't folks who believe in the ability or the right to choose. Outside of the Supreme Court, I think the Senate and House seats are up for re-election. And I just want to remind people that all of our repro bills have passed by slim margins. Like it's been 61 votes, 63 votes. Some of them it's taking us 2, 3, 5 years in order to get the protections that we have. So while we have a predominantly Democratic supermajority, that's not been the case as it relates to pro-choice issues. There was just a bill passed in the House that would allow for emergency contraception vending machines in all public universities. There were only 63 votes for that bill. It's just wild. This is a basic thing in terms of access. So those seats are really, 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 really important. And there is a universe where we may not have that 60 number that we need or the 30 that we need in the Senate. So those races are really, really critical. And I would suggest to folks, you're part of Jane's Army or you're Jane's Army adjacent, like this is the time to really let legislators know that these issues are really important to you. And if you're volunteering or if you're going to some kind of event, letting them know I'm supportive of you because you voted the right way on these issues. I think sometimes legislators even get complacent, like, oh, we've done something before, why do we need to do it again? They need to feel that as voters, we think these issues are really, really, really critical and we can't take anything for granted.
Absolutely. Yeah, I know once we are done with our Q&A, Grace is going to talk some more about how you can get involved with Personal PAC and Jane's Army, because we need all of our pro-choice champions reelected this year. So we've received a couple questions from the audience. So this one is from Jax. So she says, an anti-choice individual told her recently that there's a way to reverse an abortion pill and claims she was given an abortion pill when she had early labor to stop the labor. Can you explain what anti-choice folks are claiming the abortion pill reversal is and what it really means?
Sure. So this is a very dangerous area that, as we've been talking about, misinformation is often can really be medically dangerous for folks. So there are a number of doctors throughout the country, and I'm sure some in Illinois, who are providing patients, people who have started a medical abortion with I mentioned earlier that with medication abortion, there's 2 different medications that are used. One that's usually
I think we might have lost Allison for a second here. Kadeen or Sylvia, are you able to jump in while we get her back?
Yeah, I think Dr. Cowett was about to say that it's a 2-part process with the pills. There's, oh, there we go.
I think she's back. Allison, you were muted for a bit and now you're speaking.
gynecologists have made a claim that high dose progesterone can support pregnancy and reverse the medication abortion. This has actually been shown in a number of studies from the family planning community to be significantly, to be very dangerous. Actually, can lead to heavy bleeding for folks who have already taken that first medication, and may require, is essentially dangerous to their health and could require a blood transfusion or surgery. So we do not recommend, there's no scientific evidence that this abortion reversal works. And there certainly is scientific evidence that it can be dangerous. So again, when folks are specifically in the medical community are pushing this misinformation, it can be very dangerous for people. I'm not sure what there certainly are medications to stop preterm labor, and this may perhaps be what the anti-abortion person who was talking to that person who asked the question was referring to. But these medications to stop preterm labor are not the medications that are being used for medication abortion reversal. And I would really, there's a lot of websites about medication abortion reversal that are sort of masquerading as pro-choice reproductive rights advocacy clinics, and folks need to be really careful not to be confused about who is providing, the scientifically backed information and who is providing the misinformation.
Definitely. Thank you. So another question from the audience, this one's for anyone who would like to comment. So how can we, or the woman Lizelle Herrera, the woman in Texas who was charged with murder very recently, what does that say about the future and kind of the state we're in?
I don't know, Kadeen, if you want to take that from the legal perspective.
It's a bleak future. I mean, it's the fears that we've had for a very long time on how women's reproductive health care can be weaponized, and we see it happening all the time. I think in Illinois, with the Reproductive Health and Access Act, we built in those protections in place so somebody couldn't be charged in that way here. But again, we're a Supreme Court justice away from that, not being a real protection. So I think with our best intentions, we're trying to have the most guardrails possible, but we have to be vigilant, because if we lose the Supreme Court, if we lose our pro-choice people, Illinois can be that place. And I think, sometimes I think I've had my own moments of like, is that really true? Like, are we really going to go back? And in the last month or two, it's like, yeah, we can be there. So women's bodies continue to be weaponized by the other side, and it's just heartbreaking, but we can't just be sad about it. This is why we have to act. And I know we're all tired. We feel like we've been fighting for a long time, but that fight isn't over.
I have to say that in the last maybe couple of years or so, I've had way more folks want to talk to me about reproductive choice and what's happening across the country. More people are paying attention to what's happening across the nation. There was definitely a period of complacency as I would send out, emails and alerts and personal pack messages and invite folks to events and, send out the pamphlets that, Terry's team would send me. But now, if there's going to be a silver lining here, it's that people are paying attention and people are ready for the information and they want something to do. And I think that this is our chance to give people the tools to do something. I was just having a conversation with my sister-in-law who was talking about what's happening in Oklahoma, and she's a pediatrician, and she, was just so overwhelmed and didn't know what to do. And I was like, hey, we've got to get organized. We've got to, I was like, personal pack. Remember all those letters I sent you? And then also Planned Parenthood and Chicago Abortion Fund. And there's so many ways that you can turn that sadness or despair into, something positive. And this is that moment. This is our like Marvel Universe X-Men moment where we all turn into superheroes and channel that positive energy. And I think of Terry all the time when he, he's like, he has all these things. I'm going to butcher all of them, but he just has a way of taking the worst moments and turning them into teachable moments or positive moments. I see Terry nodding his head. Yes.
Thank you. So we're going to do one more call for questions from the audience. And in the meantime, I have one more question. So something I've been noticing just in the coverage of a lot of these state legislatures and bills that are being passed, it seems like a lot of this anti-choice legislation kind of comes up in the same conversations as anti-LGBTQ legislation. And it seems like sometimes there's maybe something like tying them together. I'm just wondering if anyone has any insights there, or how this is like playing into just like a larger conservative narrative, or just any thoughts there.
I think some of the folks who are anti-choice or LGBTQ issues as well. We've seen that in the pushback against sex ed, for example, where part of it is to make things be more reflective of the people who live in Illinois. That includes folks who are LGBTQ, and that freaks the same people who are freaked out by the idea of repealing PNA. And I think we've seen an overlay of this parental rights component even in Illinois, in terms of, we're parents, we should have the ability to decide for our kids what they're going to do or how they're going to identify or what choices that they're going to make. And we also see that there are, to your point, Hannah, there are states where if you are a parent who wants to support your child who is trans with any kind of surgery or treatment, then you could potentially be penalized. So it's parental rights, except if we don't agree with the right that you're trying to provide. So that, again, another layer of work that we have to do in Illinois to make sure that our laws and our services are able to meet the needs of folks who have to come here because they're not able to get the care and support they need in their home states.
Definitely. Grace, do you have any questions in the chat, or should we move to the next section?
Yeah, one thing I just want to touch on, but if people have any other questions, please still continue to share them. We did get a question about endorsements and who we should be focused on, especially around the Illinois Supreme Court, which I know we all have emphasized now. The word for right now is to keep an eye out on our websites, our social media. We will be making formal endorsements and sharing a voter's guide so that you are completely prepared. And Jane's Army will also be offering opportunities to get more involved beyond just voting pro-choice. So I just want to make sure you know that is coming very soon, and more info to come. So do we have any other questions from the audience? Feel free to raise your hand if you have something. Otherwise, we'll move on for a little bit. And to our speakers, did you have any final things you'd like to add for the time being?
I would say take action. I think while people are motivated, the experience that we've had in trying to move pieces of legislation is that for each one voice we have, there are 200 voices from the other side. So this is the time to mobilize. And it's like our rights depend on it, because it really truly does. So even when you get that email and you're like, do I really have to do it? Just do it, make the phone call, it's worth it. Give money and support organizations who make sure that folks who are pro-choice get elected.
Yeah, thanks, Kadeen. It's like you set me up here. Thank you. Yeah, so exactly what Kadeen said. Get active, get involved. Terry always says, don't be despaired and depressed, get active instead. So that's what Jane's Army is all about. We are an army of partner organizations, of activists, of volunteers, just like you all who came out tonight to educate, motivate, and mobilize fellow pro-choice voters ahead of the primary and November general election. So we plan on rallying, going to doors and streets, texting, calling, all for our pro-choice champions in Illinois. And we have a proven winning strategy, and we just need you all to make it happen. So like we said, we have lots of races, including the Illinois Supreme Court, that are coming up, and we really will need your help to make it happen. As Kadeen said, there are so many stronger voices out there, and we are going to have to bring everything to make it happen. And we know, as we've just heard, the stakes are so high. The states surrounding us, for the people in need of abortion care coming from as far as Texas, Oklahoma, beyond, it's not just Illinoisans. So what can we do? That's the big question. So first off is that you can take the pledge to support a pro-choice 2020, meaning that you are saying you're going to get involved in however that makes sense to you to make a difference this November. So in the chat here is a link that you can click on, and it will bring you to a form that you can sign up. And we will then keep you in the loop for upcoming events like this, canvassing, door knocking, other events, both educational, social, and political. So if you want to be in on the loop, then take 30 seconds right now. I'm going to time it. Everyone do it. Pull it up. Fill out your name. There's literally like 4 questions. If everyone does it here, then we will already have a great group of people to show up when we need you. So you got like 15 seconds left, and then I'll move on. Next, we ask is that you amplify our message. So as Kadeen said, we're outnumbered when it comes to being vocal. So if you can share on social media, over email, when you chat with your friends at coffee, can you ask 5 to 10 people to visit Jane's Army website and take this pledge like you all just did, which I'm hoping you all just did, right? I gave you more than 30 seconds. So I'm hoping that you can share, spread the word, it's more fun to show up to these things when you do it with friends. Speaking of, we have an upcoming event happening on Wednesday, May 4th. It's our first in-person event, which is super exciting. It's at 5:30 to 7:30 at the Hideout. We'll have some guest speakers, we'll have drinks and snacks, and really it's just a time to connect with other pro-choice voters and friends, to be outraged about what you heard tonight, but also to be hopeful and to be active and to maybe make a new friend that you can then show up and canvass with this fall. So in the chat, I am dropping information for that. Bear with me here. So you can go ahead and register for this event on Wednesday, the 4th. I'll be there, Hannah will be there. Hopefully some of you will be there. Moving on, as we have said, this isn't possible without the resources to do so. So if you're able to make a donation to support Jane's Army's efforts, we're gonna have a lot of hours to get through, a lot of text to send, a lot of phone calls to make. So if you're inclined, oh, I'm sorry, that's the same link. So I'll send a fresh one to you here to make a donation if you are able and interested in doing so. So those are our kind of action items tonight. Take the pledge, share our website, show up on May 4th, make a donation if you're able, and tell everyone you know about this. So I'll pause there, see if there's any follow-up questions or items that our speakers want to chime in on. Hannah, did I miss anything?
I don't think so. I think you covered it all.
I wanted to say something about chatting with lawmakers, which before I started all of this, I wish I was in a room with everyone who's in the audience, because I would see how many folks do that on a regular basis. Or before 2016, I probably didn't even know who my lawmakers were, and I got to know them very well after 2016. And LaShawn Ford is my state rep, and I got to know him, harassed him a lot because of HB 40. And one thing that I learned actually was that, he was really misinformed and really needed someone who knew something about the issue to talk to, so that he would kind of know how to vote correctly for HB 40 and then multiple other things. And, if you know, this area, you kind of know this area is pretty mobilized on that issue. But, it's part of it is just they would love to hear from their constituents about what's important and would love to be informed correctly about the issues. And so, I highly encourage it. It's kind of fun to get to know them and help them know, what's important to you. I don't know if other panelists feel kind of the same way.
I definitely feel that way. I, especially in terms of my own personal connections to my lawmakers. Don Harmon is my senator, and as an abortion provider, I endlessly nag. I
think we might have lost Dr. Cowett again.
This is Terry. I want to, since Allison is frozen, I just want to say that Kadeen and I, when we're in Springfield, the number of people that we hear, legislators that we hear from the antis all the time. We never hear from pro-choice people. I mean, so one phone call, one email, and if you can bring yourself to pick up the phone and make a personal visit, it takes 15 minutes to meet with someone. Look them in the eye, tell them why you support the bill that's up, or tell them that you're pro-choice. It's worth 1,000 emails and probably 100 phone calls to just do that one thing. So I would encourage everyone. This is a long-term strategy. We just all have to get in the habit of, even my state representative is Kelly Cassidy and Mike Simmons is my senator, both pro-choice leaders. I send them emails and leave messages in our office thanking them and saying, keep up the good work. They don't need that, but I think it's important that even our pro-choice friends, when they go to Springfield and say, I've heard from 40 or 50 people that this is important. So I encourage everyone to make it one of your good habits for the rest of your life, because we're really going to need to do it for the rest of our lives. Thank you.
I think now is a really good time to go on that visit with a legislator to, one, thank them if they've done good things, thank them for all that they've done, and also say, what else are you going to do? Because I think for some of our lawmakers, they think they're done, and there's always more we can do to protect access, full access. So I think a thank you and give me more can be very helpful. So when we go back to see them about some other way to protect and expand access, they're ready and they're hearing from their constituents that there's an expectation that they're not done.
Yeah, that's great, Kadeen. Yeah, don't we want to be the state that is not just doing the bare minimum, but doing amazing progressive things for its constituents? I do. That's where I want to live. Great. Well, if there's any other questions from the chat, please raise your hand. Otherwise, as a reminder, please take the pledge. Please come out on May 4th. There's also a ton of other amazing events happening too. We have Rise Up for Abortion Rights. They're doing all sorts of events in early May. There will also be events throughout Illinois around the Supreme Court decision. So please keep an eye out and show up and get involved, because we're not lacking for opportunity to make our voices be heard. All right. Well,
Grace
with
and Hannah, I just want to say thank you for all the amazing work that that both of you are doing, and thank you to everyone who joined us tonight. It's a Monday, so we appreciate that you spent your Monday evening with us. I hope this was inspiring and informative for everyone. And thank you to the fellow panelists.
Thank you.
Thank you.
Yes. Thank you all for being here. We'll send a follow-up email tomorrow with all of this detail, so you don't have to memorize it tonight. But we look forward to seeing you next time. Take care, everyone.
Thank you.
Thank you everyone for joining us.
Thank you.
Take care.